Hi, I'm Simon Checkley. I'm the CEO of the Regenerative Clinic, and I'm here to briefly talk to you about our knee patients who are now 1 year post-op. Let me just take you through the presentation. This slide talks about the total number of joints that are in our registry. Our registry is something we take extremely seriously. Every single patient that we treat gets scored when they come in. They get scored after 3 months, after 6 months, after 1 year, and after 2 years. So this slide shows the total number of joints that are in our registry by body part. And you'll see predominantly it's driven by knees. 396 knee joints are in our registry. This first slide shows our 3-month results. So we've got 178 patients at 3 months. On the left, the VAS score, which is significantly decreasing from pre-op to 3-month period. And on the right, you see our Oxford knee score. Now, Oxford knee score is out of 48, and you'll see here we've got a significant increase from about 28, 29, right up until just about 38, 39. So significant increase in the Oxford knee score. Okay, so this is only 3 months worth of data, 178 patients at 3 months. The next slide is more significant. The next slide shows the same scores, the VAS score, which is the visual pain score, and the Oxford knee score, which is a score that measures functionality. And on this slide, we can see that that initial result we achieved at 3 months is being sustained for the next 3 months. So at 6 months, our patients are still having the benefit of the treatment. However, the most important slide that I wanted to share with you today is our 1 year data. And our 1 year data shows that our treatment is effective at the 1 year point. Now, we're not surprised by this because this is commonly being reported in the literature at years 2, 3, and even 4 now. But this is our own data. So this is the first time we've got a good group of patients who've reached that year point. So we're now really happy because we know that what we're doing is we're able to replicate the results that we see in the literature. So this is what we'd read, this is what we'd heard, this is why we started to do it, and now we're seeing those results come through. I think the important thing to do as well is to look at the Oxford knee score. So the Oxford knee score gets to about 40 out of 48. And if we compare that on the next slide to a total knee replacement, so this is a study of lots of different knee replacements that have been done and 10 years worth of data, and you'll see that in a total knee replacement, the Oxford score gets to about 35. What we know is that our treatment outperforms a knee replacement after a year, and we hope that we'll see that in the rest of the literature. There are other studies out there, such as this one from Italy, and again, they're showing, and the red line is the adipose tissue, they're showing the same result lasting for 2 years. So basically what we know now is that we're able to replicate what we've seen in the literature, and we're able to produce a good result for our patients at the 1 year point. And in fact, we're able to produce a result for our patients at the 1 year point that's better than a total knee replacement. The collection of data on our patients is a key part of what we do at the Regenerative Clinic to enable us to prove that our treatment works. We'll be continuing to update you as our patients continue to enjoy the results of their LipiGem treatment.